Did you work this hard your entire life just to let a bad knee get in the way of your Saturday golf game? I didn't think so. But that is exactly what's happening to a lot of really good golfers and high performers right now. And it's not because they are weak or lazy. And it's also not because they're just getting older. And it's not always because they need surgery that they're just trying to put off. It's happening because most golfers with knee pain are getting handed a plan that is designed to manage the noise. And they manage the noise while the real problem keeps getting louder. And the plan revolves around this, right? Rest it. Take some anti-inflammatory pills or some Tylenol, and then if it gets bad enough, it's time for a cortisone shot. The pain settles down for a few weeks, but then it comes back. And a guy who was walking 18 holes and playing skins with his friends and closing business on the back nine, you suddenly see them riding in a cart. They're skipping golf trips, and they're wondering if somebody's about to tell them their golfing career is done. Here's the part that nobody tells you. Your knee or their knee may not need more treatment. It might just need the right 20% of treatment. Sound familiar? That is the Pareto Principle. You may know it as the 80-20 rule. This is the idea that a small number of things create the most of your results. 20% of your clients probably are the ones that generate most of your revenue. If you were like me, you probably only wear 20% of the clothes in your closet, right? Have you ever seen me not in scrubs? If you've noticed, it probably also only takes 3 or 4 holes to absolutely wreck most of your scorecard. That is about 20% of your round. Guess what? The same can be said about your knee. My name is Dr. Gayan Poovendran. I am a medical doctor specializing in sports and regenerative medicine, and over the last 15 years, I have helped thousands of golfers conquer their knee pain without resorting to invasive surgeries. Now today, I am going to show you how this famous 80-20 rule applies to your knee, and why one habit more than anything else keeps good golfers stuck. I call that the Cortisone Carousel. By the end of this video, you will know exactly how to get off of it. Before we go any further, do me a favor, follow this page. If you are a golfer with knee pain who refuses to accept that this is just what it looks like when you get older, this channel is for you. Every week, I break down what you are rarely told in a rushed office visit at your doctor. How to protect your game and make smart decisions before another shot, another vague round of therapy, or a surgery conversation that you are not ready for. This page has no fear. This has no miracle promises. It's just straight answers to help you hurt less and play more. All right, let's get into it. Actually, one more thing. Before we get too deep, if you want something that you can use before your very next round, I have put together a free 5-minute warm-up guide that is designed specifically for golfers that have knee pain. I call it the Ready for Tee Off guide, and you can grab it right now at readyforteeoff.com. It is absolutely free. It is my gift to you to thank you for watching these videos and for subscribing. There are no strings attached, so go get it and come back, and I promise I will be right here. I want to start this video really head on, and I want to talk about the problem that I've seen in medicine for the last 15 years, and it's something that is probably not terribly surprising, but it's the path of least resistance. I used to work in a very busy orthopedic practice as a non-surgical doctor. I used to see 30 to 40 patients in a day, and I want to tell you something that I saw over and over and over again that still bothers me to this day. A patient would come in with knee pain, and either the surgeon had decided that they were not a candidate for surgery, or the patient had decided that they didn't want surgery, or they were coming to see me for the first time. I would look at their knee and I would evaluate it, and then we would talk about a real plan. We would talk about physical therapy and home exercises and addressing the actual mechanics of their golf swing or whatever sports activity that they were doing. And a lot of times it wasn't what they wanted, and frustratingly enough, I was getting even farther behind in clinic because I didn't have time. What the patient wanted was they wanted the shot. Right? They wanted a shot. So they would get anti-inflammatory pills for a while, and they would kind of manage their symptoms with that in between visits. And then they would come and get a cortisone shot. And for some patients, exactly every 3 months, they would come right back in, right when I would allow it, because they knew that if they tried to schedule their appointment before exactly 90 days, I wouldn't do it because it was dangerous. And they would do this not because it was working so amazingly well for them, but they would do it because it was easy. It didn't really require much from them between visits because they're busy. They couldn't do or didn't do the home exercises diligently because life was getting in the way, or they didn't want to go to physical therapy because the therapy that they went to, their insurance was a very cookie cutter box, and they didn't really get the attention that they needed, and they didn't feel the value in it. So they come back to me and they want the fastest path to feeling normal, even if that path was quietly running out. Now here's what made that so frustrating as a physician. I could see exactly where this was heading. I watched really good, disciplined, successful people, guys who ran companies and guys who would not accept mediocrity anywhere else in their life. They kept choosing this path of least resistance on the one thing that mattered the most to their mobility. And again, I understood why. The system practically pushes you there. Let's name exactly what's happening here because I think it has a name, and I call it the Cortisone Carousel. Here's how it works. Your knee hurts or your knee is bothering you, and so eventually you end up getting a cortisone shot to put the fire out. And it works miraculously well for a few weeks. But then the pain starts creeping back in and you come back in for another 7-minute doctor's office visit, and because of the limitations of time and insurance reimbursement, cortisone and anti-inflammatory pills are often the only tool that your doctor is even allowed to reach for. Now, I'm not blaming the doctors. I was in that boat. Most orthopedic practices today are running on insurance-driven volume, which means that a physician may be scheduled to see a patient every 10 minutes. And even worse, in those 10-minute slots, there are probably multiple patients in those time slots. So during your 8 o'clock in the morning visit, there are probably 3 other patients scheduled for that same time. So when everybody shows up, the doctor starts running even farther behind. Now you end up being in the waiting room, or you end up being in that office exam room for 2 hours to see the doctor. And then there is truly no time to watch your golf swing, no time to talk to you, no time to assess your hip rotation, no time to build a real plan. I tried to do it and it was really, really hard. There is time in that system for an x-ray, an order for maybe an MRI, a quick diagnosis, and then if you're hurting enough, a shot. So that's what ends up getting offered over and over again. Every 3 months, like clockwork for some of my patients. And here is the part that almost nobody has time to explain to that patient sitting in the chair. Cortisone does not fix anything. It does not correct a weak hip. It does not teach your knee to control rotation. It does not repair a meniscus tear. It does not rebuild cartilage. Heck, it doesn't even protect your joint from further injury. It just turns the pain signal down a little bit temporarily. The entire time, the actual driver of your pain is sitting there completely untouched. And look, that might be fine if cortisone was harmless, but it is not always harmless. In a 2-year randomized clinical trial published in JAMA, or the Journal of American Medical Association, people with knee arthritis who received a steroid injection every 3 months, which is the exact rhythm that I just described and saw with some of my patients, they ended up with greater cartilage loss than the people who received a plain saline injection or a placebo. And look, I have again witnessed this firsthand. Patients went from mild to moderate arthritis to a complete bone-on-bone end-stage arthritis in a matter of a few years, just because the only way they wanted to manage their pain, or the only way they could manage their pain, was with a steroid shot. And here's the worst part of the study though. Are you ready for this? The steroid group did not even get a meaningful pain advantage by the end of the study. Listen to that again. The same injection schedule that feels like you are staying on top of it was associated with more joint damage, not less, and no better pain relief in the long run. That is this carousel. You go around every 3 months, you feel a temporary sense of control, you feel a temporary sense of improvement, and the horse that you are riding is quietly going nowhere, or even worse, it's going backwards. I'm not telling you this to scare you, and I'm not telling you that cortisone is evil all the time. I do think it has a place. It has a place as a short-term bridge, or for a specific event, or if you have a flare that needs calming down before the real work can begin. But a bridge is not the destination. If you have had 2 or 3 shots and you are still hurting, it's not because your knee is being stubborn. It is telling you very clearly, very loudly, that the real driver of your knee pain was never really addressed. So here's your way off the carousel. I have 3 steps for you. Number one, the step is find it. Find the few things that are creating most of your knee stress. That could be a stiff hip. That could be a lead knee that is caving in at impact. It could be a meniscus issue that keeps getting irritated. It could be an ankle that is too stiff. This actually takes a look at how you move, not just an x-ray or an MRI or even an ultrasound that I do and a diagnosis in a rushed visit. The step number two is stop it. Stop feeding the problem. That means stop getting a cortisone injection on a schedule that has become the entire plan instead of a bridge to one. It means putting down this whole rest, then feel better, then play 36 holes, then rest again because your knee hurts, and then get another shot cycle. Stopping this cycle and stopping the habit and stopping the pattern is probably the hardest step, but it is also the one that matters the most. And then finally, build it. Build a knee that can actually handle golf again. That means having better hip strength, better hip rotation and mobility, better rotational control, and when appropriate, a regenerative medicine option like PRP or stem cells, which use concentrated healing signals from your own body to support the joint rather than just quieting it down. Research reviews show that PRP can meaningfully improve pain and function in many knee arthritis patients, and that relief and that improvement in quality of life is durable from between 3 and 12 months. And in my practice, we often see patients at the 12-month and longer period getting relief. So find the problem, stop feeding it, and then build real capacity around it. That is the 20% that actually works. That is how you apply the Pareto Principle to your knee pain. Now here's the one thing I want you to do differently, right? Get off the cortisone carousel as your default plan. Start identifying what is actually driving your pain. If you do this, you get your time back instead of spending months on a cycle that never resolves. Think about all the time that you're spending waiting at the doctor's office, going to the doctor's office, scheduling appointments. If you don't do that, you keep riding the same carousel. You get a little relief, then a little relapse, then a little relief, and a little relapse, and you repeat this over and over again while the problem keeps getting worse, and then your options are quietly narrowing down. If you do this though, you are protecting your Saturdays, you're protecting your group of golf buddies, your golf trips, and you're protecting the identity that you have worked your entire life to keep. If you don't do this though, then the losses start to quietly compound. They start very quietly though, right? You start riding instead of walking because your knee bothers you. You start skipping around here and there because you haven't recovered from your last round. Then one day you wake up and you become the guy who says, I used to play golf all the time. That doesn't have to be your story. Here is the one thing that you can do today, right now, before your next round. Do this exercise called rotation over fixed foot. Place a club across your hips and then plant one foot firmly flat on the ground. Rotate your hips left and right over that planted foot. 10 slow, controlled repetitions on each side. This exercise directly mimics the load your lead knee takes at impact. We are training that joint to handle rotation with control before we ask it to do it at full speed. So remember, keep that foot completely flat. This gives your knee a rehearsal for the exact load it takes during your downswing before you start adding speed, a ball, direction, and your buddy teasing you that you can't clear that water hazard. So for the complete 5-minute routine, go grab the free Ready for Tee Off guide at readyforteeoff.com. Again, it has illustrated instructions for all 6 of the exercises that I recommend, and you can pull it up on your phone before every round. Imagine walking to the first tee with a real plan instead of a countdown to your next cortisone shot. Knowing what is driving your pain, knowing exactly what you are working on to change it. That is what getting off the carousel looks like. Now, if this video helped you, help me out. Follow this page and also send this to the guy in your group who has said, I'm just getting one more shot, I promise, more than once. He probably wasn't given the full picture. Before you go, grab that free Ready for Tee Off warm-up guide at readyforteeoff.com. It's 5 minutes before your round. That's it. You will feel the difference the moment you step onto the first tee and take your swing. I'm Dr. Gayan Poovendran. Now you know what most golfers never find out. I'll see you next time, pain-free on the fairway.